Part 1 Section 1A DOH Bawat Buhay Mahalaga, the medical basis bridging Filipinos to the new normal, protecting persons with comorbidities from common health issues and endemic COVID-19 by Rich Boom Camino, MD. Preview of DOH Bawat Buhay Mahalaga, the mission statement on health issued by His Excellency, President Bongbong Marcos during his first SONA, delivered at the Session Hall of the House of Representatives, Batasang Pambansa Complex, Quezon City on July 25, 2022.
Magtatayo tayo ng dagdag na mga health center at ospital. We must bring medical services to the people and not wait for them to come to our hospitals and healthcare centers. Napakinabangan natin ng husto ang malalaking specialty hospital gaya ng Heart Center, Lung Center, Children's Hospital at National Kidney and Transplant Institute. Kaya maliwanag na hindi lang dapat dito sa National Capital Region kundi maging sa ibang parte ng bansa. Bukod dito, upang mailapit natin ang healthcare system sa taong bayan, nang hindi sila kailangang pumunta sa sentro ng kanilang bayan, lalawigan o region, ay maglalagay tayo ng mga clinic, mga RHU. Nang sa ganun, magiging mas madali sa may karamdaman na magpapagamot nang di na kailangan magbiyahe ng malayo.
To answer this call by PBBM to make the Philippine healthcare system more accessible to all Filipinos from all walks of life, DOH Bawat Buhay Mahalaga can bring healthcare services to the doorsteps of Filipinos from all walks of life and all corners of the archipelago, using the most used social media platform where Filipinos surf the web, Facebook. We can initially see the patient as the online medical social media-based navigation and healthcare delivery system. We can protect the high-risk groups, the elderly, 65 years old and above, the obese, BMI, 30 and above, the pregnant women, persons with comorbidities, diabetes mellitus, hypertension as part of the metabolic syndrome, cardiovascular diseases, neurologic diseases and others. DOH will protect the high-risk groups from long lines with no social distancing in registration. Time and effort will not be wasted. Excess mortality will be averted as preventive screening tests and consults for the disease pre-COVID that we have been working to prevent and treat will again be dealt with without fear of COVID, breast cancer, cancer of the GI tract, hypertension and cardiovascular diseases, stroke, dystonia, Parkinson's, movement disorders, dementia and other neurological diseases, etc.
In the Philippines face significant challenges, including a shortage of medical professionals and facilities. But imagine this. With Starlink's satellite internet, telemedicine could revolutionize access to healthcare. Residents in remote regions could consult with doctors online, receive prescriptions, and access medical advice, all without traveling miles to the nearest clinic. Starlink could also empower healthcare providers to use advanced remote monitoring devices, keeping tabs on patients with chronic illnesses or elderly individuals. This means better, more personalized care, delivered right where it's needed. Plus, healthcare workers in these areas could tap into online medical training and education programs, improving the overall quality of care for underserved communities. Now, let's shift gears to e-commerce. Picture this, sellers in rural areas connecting with buyers nationwide, and even across the globe. With platforms like Shopee and Lazada, combined with reliable internet access, small businesses could thrive, creating new income streams and boosting local economies. And it doesn't stop there. Digital payment systems like GCash and PayMaya would become more accessible, making it easier for people in remote areas to shop online, pay bills, and transfer money. Financial inclusion would take a leap forward, reducing dependence on cash transactions. E-commerce businesses could also streamline their operations, from managing inventory to tracking shipments and communicating with suppliers. Efficiency and productivity would skyrocket, benefiting both sellers and buyers alike. Let's not forget tourism, a cornerstone of the Philippine economy. Imagine remote island destinations with reliable Starlink internet. Tourists could book accommodations seamlessly, stay connected, and share their adventures online. This added convenience could make lesser-known spots more appealing to international travelers, fueling the growth of local tourism. Hotels, resorts, and small tourism businesses in these areas could showcase their offerings through virtual tours and digital advertising, drawing in global audiences and driving economic development. In the finance sector, Starlink's influence could be transformative. For rural Filipinos, internet access could mean easier banking, mobile money transfers, and access to digital wallets. Small business owners and entrepreneurs could leverage microloans and peer-to-peer lending platforms to fund their dreams. Even the insurance industry could benefit, offering tailored products for health, property, and agriculture, improving financial security for rural communities. When it comes to energy and utilities, Starlink could enable smarter, more efficient power systems. Imagine smart grids in remote areas, optimizing electricity distribution and managing off-grid renewable energy setups. This could help address power shortages while pushing the Philippines closer to its renewable energy goals. Government services would also see a digital revolution. Residents in remote areas could access services like tax filing, permits, and licenses online. No more long trips to government offices. In disaster-prone regions, Starlink could create temporary communication networks for emergency responders, ensuring faster aid delivery and better coordination during typhoons or earthquakes. Real-time data collection would allow government agencies to craft more effective policies and allocate resources where they're needed most. Lastly, Starlink's reach could reshape real estate and urban development. Developers could create smart communities, featuring internet-enabled systems for homes, traffic management, and energy efficiency, enhancing the quality of life for residents. And as remote work continues to grow, previously overlooked locations could become desirable hubs for professionals looking to work from home, spurring new housing developments and vibrant communities. In the end, Elon Musk's interest in the Philippines could bring about a seismic shift. From the economy and infrastructure to real estate and beyond, the possibilities are endless. Here's hoping these changes usher in a brighter, more connected future for the nation. Thanks for tuning in, and we can't wait to see you in our next video.
DOH Bawat Buhay Mahalaga is complementary to Elon Musk's Starlink internet of his SpaceX satellites. Its application in medicine and surgery raises the standard to another level. It also complements the DOH free and healthy internet connectivity umbrella in providing internet access for patients needing connectivity in DOH BBM connectivity umbrella. Overview and sequence of events in DOH Bawat Buhay Mahalaga. I am Rich Boone Camino, MD, a graduate of UP College of Medicine under the intern program, published author of I Yearn to Live and Not Merely to Exist. I am differently abled, but I would like to be a part of nation building under the PBBM administration. I hope DOH can approve my proposal DOH Bawat Buhay Mahalaga after Easter, in particular with migration of Aedes mosquito following humans for the upcoming May 2025 elections, and even after the Holy Week observance. Although the case fatality rate may be low, sick children and caring parents may disrupt the economy. Sick leaves by parents plus the presence of comorbidities increase the CFRs of hospitalized dengue by 3 to 17-fold compared with cases with no comorbidities. Source: mortality among hospitalized dengue patients with comorbidities in Mexico, Brazil, and Colombia and J. Trop Medhid, 2021 May. Please allow me to present a brief overview of DOH Bawat Buhay Mahalaga by Dr. Rich Boone Camino. This is a social media-based physician-coordinated patient navigation system to protect patients with comorbidities from common health issues and endemic COVID. It will bridge Filipinos to enter the new normal. Emphasis: exit the COVID-19 era and enter the new normal by instituting primary care or preventive medicine. All participating primary care physicians shall focus on preventive screening procedures for preventable diseases and mitigate excess mortality. Last May 5, 2023, WHO Director Tedros Adhanom Ghebreyesus declared COVID is no longer a global emergency. In the local scene, DOH Secretary Dr. Ted Herbosa also affirmed that the COVID health emergency will soon be lifted. If we are to enter the new normal, we have to include, or at least be given the opportunity to all Filipinos as one people. Persons with comorbidities and the vulnerable groups must be taken into account. Also, all aspects of the project will be adhering to the evidence-based system elucidated by PBBM. Perhaps the late African-American civil rights leader best describes our situation with COVID-19. Although it may now be declared no longer a pandemic, no one is free until we are all free. Martin Luther King, Jr.
It's therefore with great hope that I declare COVID-19 over as a global health emergency.
The Director General of the World Health Organization on Friday announced he was ending the emergency he declared for COVID-19 more than 3 years ago, marking a major milestone in the pandemic that has killed more than 6.9 million people, disrupted the global economy, and ravaged communities.
COVID has changed our world.
The move comes a day after the WHO Emergency Committee recommended the UN agency declare an end to the coronavirus crisis. But the WHO chief warned that the end of the emergency did not mean COVID was over as a global health threat.
The worst thing any country could do now is to use this news as a reason to let down its guard, to dismantle the systems it has built, or to send the message to its people that COVID-19 is nothing to worry about. If we all go back to how things were before COVID-19, we will have failed to learn our lessons, and we will have failed future generations.
The WHO's declaration comes just 4 months after China ended its prolonged and severe COVID restrictions after a surge in infections. In many parts of the world, testing has dwindled dramatically, and people have largely stopped wearing masks. Ending the emergency could mean that international collaboration or funding efforts are also brought to an end or shift in focus, although many have already adapted as the pandemic has receded in different regions. Last year, U.S. President Joe Biden said the pandemic was over. Like a number of other countries, the U.S. has begun dismantling its domestic state of emergency for COVID, meaning it will stop paying for vaccines and testing for many people and shift the responsibility to the commercial market. Later on Friday, Biden said in a statement that top U.S. public health official Rochelle Walensky will step down at the end of June from her role as director of the Centers for Disease Control and Prevention. In her resignation letter, Walensky, who led the institution for 2 years at a time when the pandemic was at its peak, wrote, quote, "The end of the COVID-19 public health emergency marks a tremendous transition for our country, for public health, and in my tenure as CDC director.